on this video and thinking it's not for you, especially the guys out there who are about to leave. Wait a sec. Wondering what PMDD is and why it matters? It's more than just a hard time or mood swings once a month. It really shakes things up, not just for the women going through it, but for everyone around them too. It's hard to understand and often gets mixed up. This video helps make sense of it all, showing us how to be better friends, partners and supporters. And you'll find out how we can treat it by the end. PMDD stands for Premenstrual Dysphoric Disorder. About 5 to 8 out of 100 people with periods go through this. And it's not just feeling a bit off. It's like your body and mind are on a roller coaster you didn't sign up for. Imagine you have a calendar. Each month there is a week marked with thunderstorms. That's PMDD time. Unlike regular prepared blues or PMS, known as premenstrual syndrome, which is like having a few rain clouds, PMDD is a full-on tempest. It throws in heavy emotions, body aches and tiredness, turning some days into a struggle to just get out of bed and not snap at someone. But why does PMDD happen? PMS and PMDD boil down to how your body reacts to hormone changes, especially with hormone progesterone and its byproducts, affecting mood-regulating brain chemicals. This sensitivity can throw off the balance of serotonin, GABA, and other neurotransmitters, leading to the emotional and physical symptoms associated with these conditions. Scientists think PMDD happens because the body reacts more intensely to these normal hormonal changes that come with the menstrual cycle. They discovered that people with PMDD have a genetic difference that changes how their body handles hormones and stress. So there is a biological reason for the ups and downs caused by PMDD. There are certain risk factors that can make someone more likely to experience PMDD. Experiencing trauma or having anxiety disorders has been linked to developing PMDD. Smoking cigarettes has a strong connection to experiencing more severe PMS or PMDD. The risk is higher for current smokers compared to non-smokers and even extends to those who've quit smoking. The more you smoke, the higher the risk, with early smoking starting in adolescence being particularly concerning. But our body weight plays a role too. High BMI levels have been associated with an increased risk of developing PMS or PMDD. This risk grows with each increase in BMI, highlighting a clear link between obesity and these conditions. The DSM-5, which healthcare professionals use to diagnose mental conditions, lists 11 symptoms for PMDD. You need to experience at least 5 of these symptoms in the week before your period. These symptoms start to ease off once your period begins and are minimal or gone in the week after. This cycle doesn't happen every time, but often enough to notice a pattern, distinguishing PMDD from just having an off week. PMDD symptoms fall in two main groups: emotional and physical. Emotional symptoms are mood swings, feeling suddenly down or extra sensitive to rejection, not wanting to do things you usually enjoy, like hanging out with friends, going to work or school. Another is irritability or anger, finding yourself in more arguments or feeling unusually frustrated with people. It can be also experiencing intense sadness, hopelessness, or being overly critical of yourself. Anxiety, feeling unusually tense, anxious, or on edge. Then physical symptoms. Common physical signs are fatigue, sleep disturbances, eating a lot more or a lot less than usual, or craving specific foods, concentration issues, bloating, headaches, and muscle or joint pain. Women with PMDD typically experience symptoms for a few days up to 2 weeks, with the intensity peaking around 6 days before and hitting hardest 2 days before their period starts, especially feeling of anger and irritability. The DSM-5 requires these symptoms to be closely tied to the menstrual cycle and distinct from other mood disorders, confirmed over at least 2 cycles, although an initial diagnosis can be considered before this confirmation. The effects of PMDD extend beyond physical and emotional discomfort. Relationships can suffer due to the emotional volatility associated with PMDD. The disorder can strain partnerships and family bonds, often due to misunderstandings or lack of awareness about the condition. PMDD can impact job performance. It's also associated with an increased risk of developing other mental health disorders, such as depression and anxiety. Facing down PMDD might seem like a tall order, but there are plenty of tools in the shed. First up, lifestyle changes. Engaging in regular physical activity has been shown to alleviate some emotional and physical symptoms by promoting endorphin release, which improves mood and reduces pain perception. A balanced diet rich in whole foods can stabilize energy levels and impact mood positively, while specific dietary supplements like calcium, magnesium, and vitamin B6 may offer symptom relief for some people. Some find that reducing sugar, caffeine, and alcohol intake can help mitigate PMDD symptoms. Research into PMDD is unlocking new potential treatments. Studies on dietary supplements like vitamin D and omega-3 fatty acids show promise for symptoms relief. Self-care is a crucial component of managing PMDD. This includes not only physical care, but also setting boundaries and practicing mindfulness or relaxation techniques to reduce stress. Medications, particularly SSRIs, can be a cornerstone of PMDD management. Unlike their use for long-term depression, SSRIs can offer quicker relief for PMDD by smoothing out mood fluctuations. Birth control pills offer another option, addressing the hormonal roller coaster that triggers PMDD symptoms. It's essential to work closely with your healthcare provider to tailor medication choices to your unique needs, ensuring the most effective treatment with minimal side effects. Next option is psychotherapy, like cognitive behavioral therapy. It isn't just talking, it's about learning practical skills to manage negative thoughts and behaviors that PMDD can exacerbate. Also, digital tools like apps that help track symptoms and give tips on handling them are becoming a big help for those facing PMDD. Living with PMDD can feel isolating, but building a robust support system can make a significant difference. Online forums and local support groups offer spaces to share experiences and coping strategies. Educating friends, family, and co-workers about PMDD can foster understanding and patience, creating a more supportive environment. Thank you for investing your time to understand the complexities of PMDD management. Share your thoughts in the comments below. Don't forget to like, share and subscribe. See you next time.